Hi everybody, Dr. Cary Yurkiw here. Thank you for joining today. And today's webinar is going to be on navigating neck pain, understanding whiplash, um, concussions, and headaches. And this is a webinar that is going to be based on the book that I wrote right here. And this is called Neck Pain. It's on Amazon. And I'm going to be talking about how I treat neck pain, headaches, whiplash, and concussions in the clinic. And so for the next 20 minutes or so, we're going to go through different treatments for that and how we can help patients that have this condition. So I'm just going to encourage you to stay till the end because I do have a special offer for you at the end. Whether you want to get the book or you want to attend the clinic or maybe do a follow-up to this webinar today, I'm going to have some options for you. So please stay till the end. The reason I'm doing this today is that I want to change and save lives. And so with chiropractic care, we can make a big difference. We can help people get relief from the pain that they're experiencing. And we can improve their quality of life. And so, that can prevent things from like people going on opioids or getting, discouraged with their health. And I just attended a webinar actually this week talking about the opioid crisis in Canada and how chiropractors can help and co-manage. And that's what I mean by changing and saving lives is, if we can help people to get out of pain and improve their quality of life, it can make a huge difference. It can really change somebody's life. And so that's the mission that I have here in my clinic is to change lives in our community. My qualifications, I've been a chiropractor for over 30 years. I've seen over 10,000 patients. 4,000 of those have had conditions that we're talking about today, neck pain, whiplash, headaches, and migraines. Over 4,000 of those patients that I've seen have had these types of conditions. My story, I first started going to a chiropractor when I was a young teenager. I was experiencing knee pain and my parents took me to our family doctor. He had checked my knees several times over the course of a couple years and basically said that I had growing pains and that I was going to grow out of the condition. And then my father said he heard of a chiropractor in our area and he was going to take me there just to get another opinion. And when he took me to the chiropractor did an exam. He was the first one to x-ray my knees. And when he did, he said he found the problem. He diagnosed it. He started treatment. It took months for my knee pain to go away, but it did. And it made a huge difference in my life. It really encouraged me to become a chiropractor. I'm still running. I'm over 50 and I'm still running in races and marathons. And I'm very active physically. So my knee pain was holding me back, and this chiropractor really made a big difference in my life. And so that just shows you the power of chiropractic and how it can really help people. 3 things that you need to know today. I want you to learn about reducing and eliminating pain, how you can improve your mobility, and how you can prevent reoccurrences of your condition. So I really want to explain to you how we can do this and what you can do to help yourself. The conditions that we see in the clinic are neck pain, whiplash, concussions, and headaches. And these conditions are different. For example, there's 7 vertebrae in the neck area, in the cervical. And when nerves are compressed in the neck, it can cause pain in a very local area, like right here. Or it can cause pain in other areas of the neck. like in the muscles, or referring from the neck down into the arms. So pinched nerve in the neck can be local. It can also cause a referral to other areas. Whiplash is different because whiplash is related to a car accident. And when you have a car accident, the head's getting flexed forward and backward. Sometimes it goes forwards, backwards, and forwards again. And it causes this whipping movement of the neck, which then causes ligaments, discs, and muscles to get stretched, sometimes torn. And there's instant inflammation there to try to repair the tissue and to heal the injured area. Concussions. Concussions are related to the brain and the brainstem getting squished against the hard skull, causing compression of the neurons, and then inflammation and sometimes depolarization of these nerves. So what we can see is damage and then adaptation of these nerves or neurons in the brain as the brain adapts to the injury that the person had. So sometimes they can get a concussion from a sports injury, let's say football, hockey, basketball. My daughter had a concussion in volleyball. So, and they can also happen from slips and falls and hitting your head, and all sorts of different ways that you can get a concussion. So we do see that in the clinic too, and we want to manage that differently than we do a neck pain or whiplash. And then finally, headaches. We see different types of headaches. Headaches that relate to the nerves and the nerve flow going through the neck area. And these nerves in the neck and the upper part go around to the top of the head, the greater occipital nerve. There's a smaller nerve, the lesser occipital nerve, goes into the head area. And then, of course, there's blood flow going through the neck. There's 4 arteries going through the neck from the heart to the brain. And there's many blood vessels and veins coming back from the brain down to the heart. So if you have misalignments in your neck, it can affect the blood flow too. So it depends on the type of headache and how we treat that, but we will talk about that today too. So the first thing is, how are we going to get rid of the pain? And we want to reduce and eliminate the pain. We want to focus on which nerves are getting pinched and the irritation on those nerves. We want to open up the spaces between the bones and reduce the irritation. And then we want to reduce the inflammation that's present. So in between the bones, the nerves are coming out of these foramen, these holes in between the bones. And when there's misalignment, let's say this bone's twisted or tipping, it can pinch the nerve between the bones, causing pain in that area. And then it sets off inflammatory process where there's inflammation in that area. And then that inflammation can lead to tenderness, more discomfort, and then the muscles have to adapt, the disc has to change shape, and there's a lot of soft tissue changes in that area that are adapting to the misalignment. So as a chiropractor, we want to take the pressure off that nerve by adjusting that vertebrae, opening up that space again, relieving that nerve so it can start the healing process. And what I mean by starting the healing process is if we take the pressure off, the inflammation does its job, it repairs the tissue, and then we don't need more inflammation for repair because now the cause of the inflammation, that pinched nerve, is not pinched anymore. And of course, we want to work on the alignment of the spine, because if the spine's out of alignment, the muscles on one side are going to shorten to adapt to the spine being out of place. On the other side, they're going to lengthen or get stretched because of the spine being out of alignment. So we want to get some symmetry back in the body, right to left, and then front to back. As far as mobility goes, as the adjustments take place and the patient starts to feel relief, we want to give them mobility exercises like the cat and dog yoga stretches. And by doing these stretches, it improves mobility. It helps to see a chiropractor because they're going to give you specific stretches or advice on how to help your condition. And in conjunction with the adjustments, the stretches will help to maintain the changes in the range of motion and the flexibility in the area. So the chiropractor is going to help you not only with the adjustments, but also with the flexibility of that area. And sometimes we use techniques like spinal decompression, where we'll use a gentle pulling of the neck, or even a device like a strap or a Y strap to decompress the neck, so that the pressure, the compression that's there can be relieved. And I find that decompressing the neck is a very good technique to use, especially if there's a lot of compression in the upper part of the cervical region and the patient's getting a lot of headaches from that. Stretches. As we realign the spine, we want to make sure any tight muscles are getting stretched. By stretching the tight muscles, it helps to balance the right and the left side, and also front to back, these scalene muscles with the posterior scalenes, or the sternocleidomastoid, the SCM, these muscles, just to balance all the muscles so they're working together and they're not causing tight muscles in one area to remain, which could interfere with the healing process. The third thing that we want to talk to our patients about, and I want you to take away from today's webinar, is improving your posture. And a chiropractor can help you to improve your posture, because as they do adjustments and as you do the stretches and the strengthening that the chiropractor gives you, then doing postural exercises. Like today, I gave a patient wall angels, which is an exercise where they stand against the wall with their arms back and they slide their arms up and down on the wall. That helps to get the shoulder blades against the wall, the head back against the wall, and it retrains the body to be in the right place. So it's going to really help with posture, retraining posture, and preventing reoccurrences of the similar condition again. So we want to correct the problem, and we don't want it to come back again. And that could involve some changes to your lifestyle too. And what I mean by changes to the lifestyle is the way your desk is set up, maybe the workstation. Because a lot of people, when they're sitting at their desk, they have their head down, twisted to one side. Sometimes they have two monitors and they're looking one way, and it's causing tension in one side of the neck but not in the other. So the ergonomics of the workstation is very important. Also, changing your lifestyle, getting more exercise, eating better, hydration, nutrition, sleep, getting enough sleep, or the sleep posture, the right mattress, pillow. All of these things are important to help with the healing process in the clinic. So as the chiropractor adjusts you, improves your alignment and the range of motion, then you want to use your body to condition it, to get it to be stronger and healthier. Now, if you want to know more about this topic, and we only have so much time today to discuss this, but if you want to know more, I do have a link for you where you can come into the clinic and you can get an assessment. And right now we're doing that for 25% off for a limited time. I'm going to put a link right here in the chat, and you can just click on this link and book an appointment. Now, if you want 25% off, when you do book the appointment, you're going to use coupon code 25% neck pain webinar. So that'll be your coupon code, and that'll just help you on that first visit to get 25% off. Now, if you're not in the Kelowna area, then if you want a consultation with me, I'd be happy to do that on the phone or using Zoom, and I can discuss your condition with you, help you find a chiropractor in your area, and you'll use this link right here. And then we'll do that using telehealth, and I will discuss with you your background, your condition, and then refer you to a chiropractor in your area that can help you. If you're interested in my book called Neck Pain on Amazon that I was referring to earlier, it's in paperback, ebook, and audiobook. This is the US link for the Amazon book. So if you're in the US, use this link. If you're in Canada, use this link. And this will take you over to the book so you can read up more on neck pain, headaches, whiplash, and concussions, and how we treat that in the clinic. If you're interested in my masterclass, the masterclass expands on what we talked about today. So it'll help you to choose the right chiropractor in your area for your condition. It'll talk about pain and pain management. It'll talk about mobility and how to get the flexibility back in the area, posture, and lifestyle. So if you're interested in that, then you're going to use this link right here to sign up for the masterclass. So I'm going to put that in the show notes. Bear with me because this is the first time I'm using the chat for these links, but it looks like it's working pretty well. If you want 25% off of the fee for the masterclass for a limited time, I think it's the next 7 days, you can use this link right here and it'll give you 25% off for that masterclass series. There's 5 lessons and the lessons are released once a week. So you're going to get a new lesson every week to walk you through what you need to do to help yourself. And then the last thing I wanted to go over with you is the upcoming webinars that we have. Today's webinar is on neck pain, whiplash, concussions, and headaches. Next week, I'll be talking about 5 one-minute exercises for back pain relief. And then also the week after, I'll be talking about stress management techniques for a healthier life. So some of these webinars are geared towards our patients and helping them with some lifestyle changes, but they're also good for the general public too. If you're not a patient of ours and maybe you're seeing a chiropractor in your area, or you just want to improve your health, then these webinars, which are free on Eventbrite or on our website, can really be helpful to sign up and to get regular updates or reminders for these webinars. So feel free to sign up for these. And then last, I forgot to give you the link for that. 1 second, I'm just going to go back. So here's the link for Eventbrite, and you can follow our channel on Eventbrite, and you'll get updates when we're posting new webinars. Finally, on social media, please follow me on social media, and it's very easy. It's at Dr. Cary Yurkiw on Instagram, Twitter, Facebook, and TikTok. So please follow us there. You can also subscribe to our channel on YouTube and our podcast called Super Healthy, which is on Spotify, Android, and Apple. So you can get the podcast, and often we'll be posting recordings of these webinars on our podcast channel or on our YouTube channel. Right now we're streaming live on YouTube, but you'll be able to get a lot of these webinars by following us on our YouTube channel. I would love some feedback on today, so if you could type in the chat or you can DM me, I'd be happy to answer your questions, get your feedback on today's topic. If you have any questions, please leave some comments or type them in the chat, and I'd be happy to answer those for you. And I do look forward to seeing you at our next webinar. And for you that subscribe to the channel, I would like some positive feedback from you. So if you could like this webinar by giving us the thumbs up, that would be great. And I look forward to seeing you guys at next week's webinar when we're going to be talking about 5 one-minute exercises for back pain. Thanks again for joining me today, and I look forward to talking to you guys soon.